Your client left their first EMDR processing session looking wrung out. They went home and reported they slept for 3 hours. Processing kept going after they walked out of your door. They're having crazy dreams. Like, why are they dreaming about their ninth grade boyfriend handing them a cookie? And now they're reporting that they debated coming back for a second processing session. They weren't motivated to come today. They're feeling tired. They're thinking they just want to have a session of talking and the next session of talking, and maybe they are not ready to do more EMDR. If you don't know how to explain what just happened, then you might lose them before they ever want to do another EMDR processing session. Welcome back to Self-Carapist Therapist. I'm your host, Lorain Moorehead, LCSW and EMDR Certified Therapist and Approved Consultant. And today I want to talk about something that comes up in consultation more than people expect. Clients who had a first EMDR processing session and are on the fence about doing more. If you're working with trauma clients and you've lost someone between session 1 of processing and session 2, this one's for you. Make sure you're subscribed so you don't miss the rest of this EMDR series, and share this with a colleague who could use it. So the first thing I want to touch on, sometimes this comes up in the first processing session, but sometimes it really starts to register after they leave your office. Confusion about the process. I like to debrief after the first processing session. Like, what did we just see? What was that like? What just happened? Because oftentimes in my sessions, something has started to move. We've seen some great shifts. I expect that. And they want to know, like, how did that come up? I hadn't even had that theme on my mind. I didn't even know that situation carried the weight it did. They just have questions. So I make sure to let them know the process, what we just saw. Even though they had an overview, sometimes it's nice to put the example to the explanation I gave them. And then I talk through what to expect. I tell them that processing might continue in dreams. It does often for my clients. So I let them know that isn't going to happen the entire time you do EMDR, more than likely, but it's possible that it'll happen until you see me again. Often I see the question, am I doing this right, throughout the first processing session. I know a lot of you can relate to that too. And it makes a lot of sense for my clients because their themes are high achiever themes, being good enough, wanting to do well, performance, perfectionism. And so it makes a lot of sense that they'd be getting a lot of feedback about, internal, of course, about, I'm not doing this right. This can't be the right thing. I don't know if this is right at first. And so sometimes I do offer them the information that it makes sense that they would be having those questions, because that's exactly what we're there to process in one way or another. And so sometimes that is helpful to put that to ease too. If their question is more along the lines of, is this doing anything? Sometimes I find that you might want to switch to a different type of BLS. I've had clients even recently where I've given them the opportunity to try tapping or buzzies compared to eye movements, and they might say, I like the tapping or the buzzies. I like how they feel, but I can feel the eye movements working. And so I'd caution to be careful about how you ask, which do you prefer? Because preference and efficacy might be two different things to them. Eye movements can kind of be annoying, right? I hope that you've done them too, just so you get the feel for it. But they're kind of labor intensive. They can make you tired because it's your eyes working like that. So just when you're trying to make sure, when you're getting the right speed, you're getting the right number. And I do advise modifying the BLS for every client, because they will all, in my experience, need different durations and different speeds. The speed for your 8 a.m. client might be very different from the speed needed for your 10 a.m. client. And I've come to expect that. And so I think that that's a good thing to keep in mind. I don't have a standard setting because I'm really looking to see, I want to go as fast as we can without that being the only thing anybody's focused on. So If they think that did nothing, then maybe there's a modification that you could consider too, and that's okay. And you can let them know too that I'm getting to know your modifications, and we'll make sure that we get to the right amount. I will say that oftentimes my first processing session is longer than 60 minutes. And so I do give myself the opportunity to work through all those questions generally in my first processing session with a client. Number two, maybe you notice that there is some parts resisting processing. So from an IFS perspective, maybe they have strong protectors that are kind of coming in and guarding all of the memories and things. And I think that that is expected, and time, maybe additional resourcing, maybe building additional trust with you, and maybe really leaning into the IFS work if that's a modality that you're comfortable with, and letting them know that it's understandable. You're not trying to make any parts feel uncomfortable could be a helpful reminder there too. Just noticing that another example is that sometimes the person is really tired. It made them really sleepy. And this could be that the target wasn't closed. Then the processing hadn't completed. The PC hadn't been installed by the time that they left, which is, of course, very common, probably more common than not for many, many people. And so noticing that that processing will continue because the loop is still open. So it might not be what they will always expect, but it might really have allowed their brains to be open to, oh, and this happened, and that happened, and this happened. And that's when we're not talking about anything traumatic. The dreams aren't nightmares. It's just kind of noticing things in that your brain is aware of that are tiring you out. And so I think oftentimes encouragement to be able to do another session, to be able to get closer to closing that target and installing the positive belief can really help with that tiredness and that constant processing. And I think that is reassuring to clients to hear sometimes too, that I've had clients ask me before, is this always going to be like this? And I'm like, no, we're going to close that target, install the belief, and it's going to feel very different when you're leaving with a closed target versus one that you're still working on or one that still has some disturbance. So that could be an important tidbit to include in your first appointment or in your check-in after your first appointment, that this is all interesting information that's coming up. And it won't always feel like a constant state of processing. It's better to close that loop and install the belief in most cases. The next one is that there is the possibility that way too much was done and it opened up way too much. Maybe it needed to be a closed loop where you kept it a bit more contained. It wasn't a totally open processing session. And I always think it's okay to observe that maybe if the client had a difficult time keeping one foot in the present, that maybe they need a lot more resourcing. And that is totally okay. And I don't mean one more session of resourcing. I mean, maybe they need several. Maybe they really need to be practicing integrating some of those resources like calm place, container, light stream, maybe even some flash technique in between before they process again, because they really needed more safety and containment than they had in that first session. That is the one that has come up before in consultations where I'll say, instead of going back in your next session and closing the loop, let's bring a lot more resourcing on board. I say this all the time, but resourcing isn't something I gloss over to get to my EMDR processing sessions. That's somewhere where we can spend a lot of time, because sometimes people just show that that's what they need. If they're talking for a full hour without interjection or room for questions and it's very pressured, sometimes that'll show me that we need to bring a lot of resourcing on board. And that is a very helpful thing to bring to a client as well. So I don't think of it at all as that we're delaying their relief. I think that that can be a really important thing for them. So I think it's great just to know the options to meet your client where they are and be able to offer that to them. When a client hesitates before their second EMDR session, they are giving you important clinical information. Exhaustion, numbness, overwhelm, confusion about the process, each one points somewhere different. Your job is to know which questions to ask. If you're still working through this, after this episode, I do offer individual EMDR consultations as well as individual EMDR therapy sessions. And you can find all of that information at lorainmoorehead.com. I hope this helps you have that conversation with more confidence. See you in the next one.